Dr. Megan Mello. I'm a board certified family and obesity medicine physician in Seattle, Washington, and I'm here today to talk about why we might start using anti obesity medications. Now, in the past, we may have referred to medications as diet pills, as weight loss medicines, but really, we are now using the term anti obesity medications because we have a much more nuanced understanding of the factors that contribute to abnormal weight gain, to metabolic dysregulation, and to the disease that we call obesity. Now, of course, there are many factors that can go into uh, the diagnosis of obesity, and we could spend a lot of time talking about all the complexity and all of the judgment and bias and the inadequate descriptions that we have for what we call obesity. But for today, we're really focusing the conversation on anti obesity medications. So I think it's important to acknowledge, though, that because we have not had a good understanding of all the factors that can contribute to obesity, we have not been able to offer people effective tools or safe tools always in the past. I think of medications that help to treat obesity as tools. They don't do all of the work for people, but they can be very, very helpful in overcoming many of the obstacles that human bodies face when we are trying to work on improving health through reducing excess body fat. Okay, that's really what it comes down to. We are trying to help with metabolic dysfunction that contributes to diabetes, heart disease, fatty liver disease, all sorts of other conditions, and removing excess body fat. Excess body fat, especially body fat that accumulates in the wrong places, such as in the liver, in the muscles, in the lungs, in the neck and airways, contributing to sleep apnea, right? Excess body fat that occurs in sort of the wrong places in the body can really increase inflammation and cause a lot of problems. And so when we are using medications to treat obesity, they are really working in a variety of places and in a variety of different ways. So let's talk about it. Now, there are three main places where our anti obesity medications work. And by anti obesity medications, I am certainly talking about our newer medications like Wegovy, which is the weight loss version of Ozempic. I am talking about Zepbound, which is the weight loss version of Mounjaro, right? Those medications are also called semaglutide or tirzepatide. But I'm also talking about older medications that we frequently use to help treat obesity. And that includes really old medications like metformin, which is a diabetes medication. It includes old stimulant medications like phentermine, which help to work on appetite regulation. It also includes a few other medications that we use for various conditions. For example, Vyvanse, which is lisdexamfetamine, I can never say that one, can be very effective for treating binge eating disorder, right? It is a condition that frequently contributes to obesity. So, although the weight loss medications, specifically Wegovy and Zepbound, are getting so much attention right now, we really have a variety of medications in our toolbox. Why would we choose to use these medications? Now, it is absolutely possible for human bodies to lose weight without medications, without surgery. And it also is a challenge. We know that from people's lived experiences. We happen to live in a moment in time where our food supply is robust, right? Most of us are years and years away from famine, meaning that there is enough food to feed all of us for years and years, even if we didn't produce more food right now. I don't know what the statistics are, but especially with our highly processed foods like Twinkies and Doritos, there are enough calories to feed probably everyone in the world for years. They are not evenly distributed. The calories that are available are not all good quality. And many of the kinds of foods that are out there right now are really causing harm to our bodies. The ultra processed foods that are out there are incredibly easily absorbed and digested by our bodies, and they're absolutely contributing to obesity, diabetes, heart disease. That full topic is for another day, but just to say that when people are existing in this world where we have too many foods, where we have so many ultra processed foods that are contributing to this problem, medications can become a very helpful tool. I don't love that this is the situation that we're in, that we are trying to fix the problem of too much food and too many ultra processed foods by using medications. But this is the reality that we live in, and we can let go of the judgment about it, and we can try and resolve it on a macro level, at the level of the food companies, at the level of nutrition science, at the level of public health. But for right now, while humans are suffering, let's talk about medications and how they help. So that is definitely one contributing factor, right? We've also got genetic risks, right? We have people who are at high genetic risk for conditions like diabetes, which contribute to metabolic dysregulation. And that is another challenge that we are trying to overcome with medications. So, what are the targets of anti-obesity medications? There are three main targets that I think about when it comes to figuring out what is going to work best for my patient, trying to figure out where they are, what challenges their particular bodies face. The first challenge is kind of the oldest and kind of the most straightforward, although it's actually not quite that simple. The first challenge that we might try to overcome with medications is hunger and appetite. Now, hunger and appetite are something that really all of us experience, right? We are designed to become hungry, and our hormones help regulate that. We've got a hormone called ghrelin. We think of that as the stomach growling hormone. There goes mine, right? Ghrelin is a hormone that tells our brain that it is time to eat. And our brain can become increasingly distracted when we are very hungry. This system is designed in such a way to keep us from starving. Now, again, we are thousands and thousands of years into evolution, and most of us don't need to have a cue to eat, but it's because our bodies have adapted this mechanism to increase our hunger hormone to cue us to eat. Now, some people experience excessive hunger, and their hormones that regulate hunger and appetite are so dysregulated that they always feel hungry. They always have a physical sensation of hunger, even when they've just ate. So that is one challenge that we might need to navigate. How do we decrease their hunger and increase their fullness? We have a few different ways that we can do that. Again, our medications like Wegovy and Zepbound certainly help with that. Our stimulant medications like phentermine or Qsymia, which is a combination of phentermine and topiramate, they absolutely help regulate hunger. Another challenge that we need to figure out for people is metabolic dysregulation. When I'm first seeing somebody in my clinic to help figure out what the challenges are for their body when they are trying to lose weight, we do blood work to evaluate, is there metabolic dysregulation going on? Sometimes yes, sometimes no. Sometimes we can predict that there will be, or that the person is at risk for that, simply by what their family history is, right? If you've got lots of family members with type 2 diabetes, you are genetically at risk for the same outcome. And at some point, you are likely to develop insulin resistance, and that leads to prediabetes, which eventually leads to diabetes, right? If we catch that, or better yet, if we even prevent you from becoming insulin resistant in the first place, then we can prevent diabetes, right? When we have diabetes in our bodies, it is much harder to lose weight. It is not impossible, but we really need extra tools typically in order to have success. So we're evaluating and working on metabolic dysfunction. Now, when we have metabolic dysfunction to treat in a person's body, that leads to different medications than somebody who's struggling with hunger. Now, again, one of the reasons why our medications like Wegovy and Zepbound are so popular is that they do multiple things, and other medications can work like that as well. In in that example, the GLP-1 medications, they work on hunger and appetite, as we previously discussed. They also help with metabolic dysfunction. And another medication that I use quite commonly for my patients is a really old type 2 diabetes medication called metformin. Metformin is a pill medication that is taken daily, and that helps to reduce insulin resistance by improving what's called insulin sensitivity. Improves the relationship between insulin and blood sugar so that our blood sugars can be better balanced, our insulin levels can drop down to normal levels, and that can really help a person to be able to be successful in reducing body weight. So there's a number of medications that can help. Some of our medications only do hunger. Some of our medications might only help with metabolic factors, but some of our medications can do more than one thing. And again, that's one of the reasons why our GLP-1 medications like Wegovy and Zepbound have been so incredibly popular and successful. Now, another area that we might need to work on, and it's more common than a lot of people recognize, is all of the brain components that contribute to obesity. What do I mean by that? I mean things like food chatter, food noise, cravings for foods, eating behaviors that are triggered by the brain. So stress eating, emotional eating, right? Celebratory eating. There are so many instances where we are using food in order to have some kind of effect, but we are not using it necessarily to treat hunger. The idea in our bodies, right, is that we are supposed to eat food on a regular basis, multiple times per day in order to give our body fuel. But again, in this food environment, a lot of people, very normal human beings, turn to food for other things. We might turn to food to celebrate with others, right? Birthday cake. We might turn to food to reward ourselves for a difficult day, right? Stress eating. We might have a lot of food chatter in our brains where we spend a lot of time thinking about food, planning our next meal, wondering if we're going to stay on plan when we're trying to eat better and go on a diet, right? All of those brain components can become a real barrier for people. And again, our medications can sometimes be very helpful in allowing people to navigate that challenge, because that is a challenge. Those are all things that really happen frequently in human bodies and brains, and they frequently become an obstacle when we are trying to improve our health and reduce excess body fat and treat or prevent metabolic dysfunction, right? If our brain is constantly giving us the idea that food would help us to feel better when we are trying to stay on plan, right, and eat healthy and eat clean, we often are operating in a space where we are denying ourselves comfort, where we are, not being able to help ourselves treat our emotions. And it's not very functional or helpful or healthy, really, to respond to our emotions with food. And yet, that's a very normal pattern for people. But it's not as simple as simply telling people to stop, right? We need to learn some emotional coping tools. We sometimes need medications to help us with that, right? To help interrupt some of the cues to eat in order to help our emotional feelings feel better. Sometimes we need medications that will help to dampen the constant food thoughts and food noise and food cravings. And again, this is an area where our GLP-1 medications are really doing people a lot of good, because it really seems to work to help decrease food chatter and food noise in a way that allows people to eat more healthy. People will often tell me that they crave sugar less, they crave salt less, and they are more interested in eating more fruits and vegetables and eating more healthy food, right? We can't discount the effects of that. When we talk about medications to treat binge eating disorder, like Vyvanse or lisdexamfetamine, again, hard for me to say, it's just the reality. that is a medicine that is helping to interrupt the pattern of binge eating, which you can think of as stress eating on steroids. Binge eating disorder as a diagnosis is recurrently eating in a rapid time frame usually, sometimes in secret, sometimes in front of other people, but eating a large amount of food fairly quickly, often having physical discomfort as well as emotional distress after eating. It is not simply overeating and kind of laughing it off. It is a distressing experience for people. And binge eating disorder happens when we do that regularly. There are different severities of it, but it is an underdiagnosed eating disorder. It's newer in the classifications of eating disorders, and it often requires medications or intensive therapy to really help people undo that pattern. It is absolutely treatable, but if you struggle with binge eating disorder or occasional binge eating or frequent overeating or frequent food thoughts, chatter, cravings, food noise, you may need help, including medications sometimes, or including therapy or support from someone who can help you work through that. So these are the multiple areas where our medications can be quite helpful. So again, regulating hunger and appetite, treating metabolic dysregulation that is leading to excess body fat and certainly contributing to chronic disease, which is not a part of everybody's experience of obesity, but it is frequently a part of it, as well as navigating, these challenges in our brain around eating, food noise, cravings, chatter. Sometimes people experience just one of these areas of struggle, and sometimes people experience all three or a combination of several of them. But because it is more complicated than simply calories in, calories out, which has never been shown to be helpful, according to the evidence, we need tools like medications. We need tools sometimes like bariatric surgery to be able to improve a person's success in reducing excess body fat and helping to prevent chronic diseases related to obesity, right? I've touched on diabetes, heart disease. Obesity doesn't have to be present for those conditions to occur, but they often co-occur. Similarly, things like arthritis and low back pain. You don't have to have obesity in order to have those things, but you are higher risk to have those things with obesity. And so when we really think about how do we take better care of our bodies, often eating in a more healthful way, moving our bodies more, and when we need to, using medications or using tools like bariatric surgery to help people have success. So I hope that helps to explain some of the reasons why we turn to medications, as well as give you a sense of what are some of the medications that we use. Again, our GLP-1 medications like Wegovy and Zepbound are being so talked about right now that we forget that we do have other medications in the toolbox. I encourage you to reach out to your primary care physician, or if they don't feel comfortable in navigating and helping you, then certainly find an obesity medicine trained physician who can help you to evaluate what is going on for you, talk about some of these particular challenges, and help you find a successful strategy. I often use medications with my patients, but not 100% of the time. Sometimes it's simply figuring out what else do we need to add to your regimen? What else do we need to tweak in your nutrition plan? What else do we need to do to help navigate stress and sleep and physical activity so that you can be successful, so that you can feel healthy, so that you can feel good, right? If you feel healthy and good and great, more power to you. If you need help, please get help. All right, that's what I have for you today. Until next time, take care.